Back in 1974, there were no graduate medical education programs in the state of Idaho. The thought was we needed to create one so that we could have residency programs to recruit physicians into the area, train them in the state, and then the retention of them would be enhanced in the state. We started our first program here in 1975 and became the first graduate medical education program or residency program in the state of Idaho. At that time, the name of the program was the Family Practice Residency of Idaho because it was a family practice residency program. In about 2003, we changed that to the Family Medicine Residency of Idaho and have been with that name until just this year in 2022, when we renamed and rebranded our organization as Full Circle Health. Part of the reason we did so is that we had become more than just a family medicine or family practice residency program. We've now added pediatrics. We also recognized that the Family Medicine Residency of Idaho didn't quite have the name recognition in the community. They weren't sure, was it a clinic? Was it a residency program? What exactly was this? So we came up with the idea of Full Circle Health. And I really like that name. And the reason I do is that it really tells a story about who we are. We take care of patients from the very first day of life to the very last day of life. We deliver babies, take care of kids, take care of pregnant moms, take care of young adults, middle-aged adults, old adults, and people on their deathbed. We go full circle with people. And at the same time that we do that on the patient care side, we go full circle with people on the education side. We bring brand new medical students that have just recently been graduated and minted from medical school or osteopathic school, and we train them for 3 years in either family medicine or pediatrics residencies to become a fully licensed, independent, board-certified physician. We go full circle with them, from the very first day of their practicing lives to now a competent, caring professional ready to go out and spend the next 40 years of their life taking care of people and communities. We now have 4 family medicine residency programs, our largest and our first here in Boise. Our second is in Caldwell. Our third is in the Magic Valley, the communities of Twin Falls and Jerome. And our fourth, which just started 2 years ago, is in Nampa. And with the addition of the pediatric residency, which got accredited just this year in 2022, we will start its first class with pediatric residents on 1 July 2023. And complementing these 4 family medicine residency programs and 1 pediatric residency program are 6 fellowship programs. These programs are in sports medicine, geriatrics, obstetrics, HIV and viral hepatitis, addiction medicine, and rural medicine. I think the mission statement of Full Circle Health says everything about who we are. We're equal parts education and equal parts service. And I really like that, the balance of that, the harmony, the synergy of that. Because good patient education, good resident education results in really excellent patient care. Great patient care results in an outstanding education. So the two really harmonize together. So we have a dual mission, one of educating the best and brightest family medicine and pediatric residents that we can train. And the second is service to people, to care for them, especially the underserved. We have about 30,000 patients that we care for in our clinic system of Full Circle Health. And those patients come from all walks of life, from those that are underserved and need the most attention, all the way up to CEOs, United States senators, and the governor of our state of Idaho.
In addition to our underserved people, we have people with commercial insurance who come to this clinic. I have a CFO in my practice, and I have people who were vice presidents of human resources back in California and came up here to retire. Out in our Western clinics, we still have seasonal farm workers out there who we take care of. And then increasingly here, we've started helping the homeless population in Boise. We have a lot of refugee patients, thousands of refugees who've been our patients for years, who come to our clinic system.
It's one of the original teaching health centers where there's a federally qualified health center and a residency program married together. It's a program that's been around since the late 70s, so it has a very good track record and well established in the community. That's a good thing for residents because there's some stability in the organization and it's had a chance to evolve over time to really focus on how to provide the best education and best patient care.
Full Circle Health became a federally qualified health center back in 2007. Part of the reason we did so was that about 85% of our patient population were either uninsured, Medicaid, or Medicare. So we had the population, but we didn't have the designation nor the payment that went with that from the federal government and from Idaho Medicaid. So by converting in 2007 to a federally qualified health center, we were able to do our mission now with a margin, which allowed us to grow over time.
There's a collegial environment here where people are supportive, they're very, very well amenable to questions, to ideas. They're helping you learn. There's a teaching culture here, both among faculty and residents, and everybody's trying to help everybody else learn. It's a huge team.
The type of person that's going to do well at Full Circle Health is somebody who comes here seeing the big picture, wanting to make a difference not in a organ or a specific disease or a very narrow category, but it's coming in here looking for a challenge of understanding how the complexity of a human life and family integrated with a community and society actually plays out in terms of a person's health. They'll come here with that attitude of positivity, openness, seeing the big picture, having a humility to understand that they will never know everything, but they will learn a lot, and that they'll be able to bring together all the skills from these other expert faculty that they'll be working with, along with nurses and medical assistants, in a way to put it all together for a human being. So they're going to be bright, they're going to be motivated, they're going to be team players, they're going to be optimistic, and really they're going to learn how to lead a team. I look at the role of a family medicine doctor in particular, and it can be said for a pediatrician as well, as being a conductor of an orchestra. You've got all of those instruments out there. Your job is to play a beautiful piece of music, and you've got to be able to figure out for each individual how best to utilize the talents and skills of all these other people through you to then help bring that all together. That is magic. And that's what I think we can do here if we get that kind of engaged, open learner.
If you're looking for a wide variety of clinical experience, if you really want to take care of people who need it, and you're open to working with a diverse group of patients from all walks of life, then this is a great place for you to learn.